Scott Loveridge with the North Central Regional Center for Rural Development and Director of the Community Assessment and Education to Promote Behavioral Health Planning and Evaluation Project, which is jointly funded by the Substance Abuse and Mental Health Services Administration and USDA NIFA. This is a project of the 4 regional rural development centers, and I'm your moderator today. We do have the chat box open, so as we're talking, feel free to put your questions into the chat box and we'll get to them at appropriate moments. I'd like to now introduce our speaker, Dr. Mark Skidmore. Dr. Skidmore is Professor of Agricultural Food and Resource Economics and Economics at Michigan State University, and he holds the Morris Chair in State and Local Government Finance and Policy. He received his doctorate in economics from the University of Colorado and his bachelor's degree in economics from the University of Washington. He serves as co-editor of the Journal of Urban Affairs and is a visiting fellow at the Lincoln Institute of Land Policy. He's got expertise in public finance and urban and regional economics, and he's giving this talk because we have noticed that communities involved with the project would like some more tools in evaluating all the different interventions that are out there. So he graciously agreed to give us an overview of some of the concepts that one can use to do that. And we are getting some sound issues. Hopefully you can turn up your volume and hear. But let's go ahead, Mark.
Okay, thank you, Scott. Appreciate all of you taking some time to be here and think about how we measure programs that we offer. Looks like we have several. Let's talk about how we think about valuing public programs that are offered. We know that these kinds of programs, for the most part, are funded through public expenditures, and those require tax dollars. And unlike the private sector where the bottom line is profits and you can measure how well you're doing by looking at your revenues and subtracting your costs, and you can say, okay, we're doing pretty well, let's keep moving and let's expand. In the public sector, there is no such similar framework for that, and so economists oftentimes use cost-benefit analysis to evaluate the efficacy of these kinds of programs. And this is done increasingly in larger programs, but maybe not in smaller programs, maybe not in local governments. And so we thought we would spend a little bit of time talking about how we value or how we estimate the costs and benefits of a public program, like the kinds of programs that you all are involved in. I guess the first thing I'd like to do is do a little poll just to kind of get a sense of where you are coming from. Scott, if you would pull in the poll here, maybe we can do that and we can find out who's working where. Please choose.
You want me to broadcast the results?
Sure. Okay, so we have a good mix of people. We see a lot of people, or a number of you, a good proportion working in mental health and substance abuse, and then a mix. Most of you are working either in hospital or health-related institutions, some within state government, only a few people working at the local level or within the federal government. Okay, well that gives me a sense of who I'm talking with. So I'm going to close this out. Have you all had a chance to see that now? Okay, so we know that these kinds of health-related interventions are targeted at improving citizen outcomes, health outcomes, and this requires expenditures. We have benefits, but how do we measure those benefits, and what do we include in that? That's what we want to focus on. Costs are a little bit easier to take a look at. So, and one last note before we dig in here, I want to really emphasize the notion of public value. A lot of times the benefits may accrue to the individual. They have a better quality of life, maybe higher income earning if they're able to, let's say if it's a substance abuse issue, they can retain and hold on to a better paying job, and over the lifetime those benefits accrue to the individual. But there are lots of public benefits as well, and as you'll see in the example later on, these public benefits can be quite substantial potentially. So I just want to talk about those kinds of issues. So let's take, for example, a substance abuse or alcohol addiction program. Suppose the intervention program results in the rehabilitation of a young mom with a child. And so let's think about the benefits of that program to the individual who is their direct recipient, but also these other potential benefits. And then we have to think about the costs, which really come from the taxpayer. And so who benefits, who pays, and importantly, we want to think about when these costs and benefits accrue. So there's a dynamic element to this. And for this reason, I think it makes it a little bit more difficult to think about these benefits, especially oftentimes policy decisions are made within a short cycle, an election cycle or something like that. But the benefits accrue over a very long period of time. And so in order to tell the story of the benefits and costs of these kinds of programs, we have to look beyond just the immediate policy cycle where people are making decisions on policymakers and legislators are making decisions on policies. I think you all knew that, but it's an important point to make. Okay, so let's start with benefits. Of course, if there's a successful rehabilitation, there are private benefits going to the person who is the direct recipient of that program. There's greater income earnings of the mother. We may be able to quantify that, and I'll show you as one example how we might do that. We also have improved health and quality of life for that individual. There are some indirect ways of calculating that, although some of those kinds of quality of life issues are harder to measure directly. But suppose this mother has a child. Well, we know that a child that is loved and cared for and has a stable home environment is far more likely to stay in school, is far more likely to be successful as an adult. And so we want to think about the benefits of these connected individuals as well. And finally, this public benefit. We know that a successful rehabilitation ultimately leads to lower public spending on things like welfare programs, the penal system, the courts, the food stamps, foster care, etc. In addition, over time, if a rehabilitated person is able to maintain a job, they may actually generate tax revenue. And so those are considerations as well. And finally, this is really important. It's not just the benefits that might accrue in the form of income immediately after the rehabilitation, but if the rehabilitation is really long-lasting, we want to measure income for years into the future as well. And so that's a little bit of a challenge in terms of quantitatively getting a handle on that, but it's not overly cumbersome, I don't think. By the way, if you have any questions along the way, you can put your note or your question in the chat, and Scott can alert me to that if that comes in. I see LaCrista says that there's no PowerPoint, but Scott says there is a PowerPoint. So hopefully we just have a little glitch that we can fix here. Okay, I've included a link here. When we talk about benefits accruing over time, economists and those in the finance industry know that a dollar today, we all know this, a dollar today is not the same thing as a dollar in 20 years. We'd rather have a dollar today. So we have to come up with some reasonable method of bringing a dollar 20 years or 15 years in advance and valuing it in today's terms. And this is called a discounted present value. And I've provided a link down here. I'm not going to take time to talk about how we bring future dollars into today's terms right now, but it's an important concept that if we want to do a cost-benefit analysis and we're receiving benefits well into the future, that we want to bring all of those dollars in today's terms. But I'm not going to spend any more time working on that given or talking about that given our limited time frame. Oh, good. It looks like we have one person with the PowerPoint working now, so it looks like we're all on board. Good. Okay. Program costs. We know that there are oftentimes initial startup costs or investment costs, initial capital expenditures, computing, all of those kinds of things. Over the long haul, the operating costs are probably dominate. There's labor, there may be rent, there might be other operating expenses. These costs are available via, let's say it's a local government, and so those kinds of costs are easily accessible. Depending on how we do the cost benefit or benefit cost analysis, we might want to think about costs today as well as costs into the future. In the example that I'm going to go through here in just a little while, we're not going to do it in quite the way where we have to do all of the costs over time. We're going to focus on 1 year of costs and compare that to the benefits that resulted from the programming in that year. Okay, so here's an important question. Suppose you're a local unit or some sort of institution, and you receive 40% of your total budget from federal dollars. Should we count the expense for our cost-benefit purposes only at 60% of the budget because those are the local tax dollars being used, or should we use the total budget? It's tempting to want to just use only our dollars, but if we want a true picture of the true costs and benefits, we want to use the full cost of the program, including all dollars from regardless of their source. Okay, so that's an important point. All right, so let's go through each of these pieces on the benefit side. We have a direct benefit to the recipient. They're going to be healthier. They may be able to also earn a higher income over their lifetimes as a result. There's a benefit to connected people, family members, in particular children who might have a more stable home as a result of the rehabilitation. As a result of that, we know that about almost 2/3 of foster children, children that end up in the foster care system, have some sort of issue with parental substance abuse. So a lot of the kids that end up in foster care, it might not be the only reason they're in foster care, but substance abuse is a piece of that. So if they can keep a rehabilitation can keep families together, the potential outcomes for the child, as we know, is going to be far better. And then finally, we have this public benefit. We want to try to quantify that. And then we have to subtract our costs. So we're going to go through each of these pieces one by one. And I'm going to draw on a few studies. There are many studies available that try to quantify the benefits of different types of programs. So I'm focusing on substance abuse. We can do prevention. We can do other kinds of health intervention programs, and there are studies out there that can help inform the costs and benefits of your program. So this particular study by Oggins et al. Show that, actually there's a typo here, it should be annual income. Annual income increases by about $3,600 per year after the treatment. And this is measured about 18 months out. So we have to make some assumptions about how lasting that may be. But that's one estimate. I'm going to just refer to that and say, okay, So maybe there are some other studies that do similar kinds of estimates, but this is one example, and there are significantly, you know, potential increases in income that these researchers identified. Now this study is a little bit older, so we might want to modify this to take into account changes in income over time or changes in prices. But let's say about $4,000 per year increased annual income. About benefits to the child. This is a little harder to get at. One study by Viner and Taylor show that relative to the general population, uh, uh, a person who went through foster care as a child and is now an adult is 3 times more likely to be unemployed, 3 times more likely to have been homeless, 1.4 times more likely to have income in the lowest income quartile, and 1.5 times more likely to have alcohol problems. So I wasn't able to find specific data on the income earning potential for a child who is a child of in a substance abuse related situation with a parent. But this clearly, since we know that foster children are often end up in foster care because of substance abuse, we can draw on some of this kind of research. By the way, I do want to say that, you know, I'm focusing on increased income earning potential because that's a measurable thing. We might have changes in quality of life and health, which are a little harder to measure in terms of dollar terms, but those things may exist as well. Let's turn to public benefits. We know that when somebody is rehabilitated, we're going to receive some health care related and penal cost savings. This recent study that I have listed here by Etner et al. Shows that for every dollar spent on substance abuse, we receive $4 in healthcare cost savings and $7 in penal cost savings. So that's a substantial public value. Typically, somebody who is in a substance abuse issue may not have the resources to pay for the costs associated with health care, and certainly not the penal costs if they end up in prison or jail for a period of time. And so the taxpayer has to cover this. And the point is that if we can avoid that, we save tax dollars in the future, and these tax dollar savings are substantial. That's quite a bang for your buck. But this is also measured over time, right? So what I tried to do is take a look at Oakland County, Michigan. This is a well-run county in Michigan that has a substance abuse treatment program. And their budget was over $9.6 million in fiscal year 2013. They fund and manage about 17 treatment contracts in the county. It's in the outskirts of Detroit in the suburban areas. It's a fairly well-to-do county. And so what I wanted to do is think about these costs and consider the number of clients they served over the course of the year, and then use the research that I just cited to do a rough calculation of the benefits and then compare it to the costs and see how we're doing on benefits and costs and whether there's a net benefit to society. And of course, some of those benefits accrue to the individual who received the treatment, and some of those benefits accrue to people who are related to the person who received the treatment. And of course, and then finally, the public value. There are benefits in terms of savings on these additional costs that could be accruing down the line. All right. So here are some important questions. First, we have to think about what proportion of those people undergoing treatment that were successfully rehabilitated in the long run. and maybe there's some variation. I found one source by the National Institute of Health that suggests the drug addiction relapse rate is about 50%. So let's start there with a 50% success rate. And then another important question, and this is really difficult to answer, is if it hadn't been for the county substance abuse program, how many clients would not have underwent successful treatment? And it's difficult to know this, right? Because maybe they would have rehabilitated on their own or received help in some other way. So I'm going to assume that about half of the authorized clients would not have otherwise been rehabilitated. And then finally, we have to think about the accrual of the benefits over time and how we value future benefits, which I've talked about. So there were about 2,600 authorized clients in Oakland County that went into rehab. And let's us use the NIH 50% success rate. So that's about 1,300 successful rehabs. And then let's, again, we can test the sensitivity of this, but let's use the 50% of people not otherwise rehabilitated if it hadn't been for this particular program. And so now we're at 654 successful rehabilitations that would not have otherwise been rehabilitated without this program. We can test the sensitivity of this, and I'll talk a little bit more about that in a bit. So the total cost of the program, these are within a particular year. This doesn't embed within it the capital costs, but it's a good first run estimate. We had 2,600 authorized clients, and so the costs are about $3,700 per authorized client. But let's do another calculation. Let's divide the total cost by the number of successful rehabilitations that wouldn't have occurred without the program. And that's about $15,000 per successful rehab. Okay, so there's several different ways to calculate costs, and so I want to keep that in mind. And again, we can do some variations on this as well. Test the sensitivity. Let's turn to the benefits. I think you'll be surprised here. So we have higher income of the recipient over the working life times the number of successful recipients per year in this program. So let's for purposes of this example, we have cost savings of income increases of about $3,600 per year according to the study I referred to earlier. And let's go out about 15 years. That equals about $54,000, 15 times 3,600. But we're going to take the discounted present value of that, so that's about $36,600. Let's divide that multiply that figure by the number of successful rehabilitations that would not have occurred without this program. So the sum of that is about $24 million. And I'm going to do one other calculation here. Let's actually, this is going to be a higher number here. I should have, see the 16 million? I'm going to see the 16 million. It should have been 23 million. So it's actually quite a bit larger than this. It's going to be about $9,000 per authorized client of benefit. And I want to keep your eye on that figure. Okay. So now let's think about the benefits to the children of the clients. Higher income for the child over the adult life. We don't have direct income on this, so let's assume a similar income differential as the mother, just as a ballpark estimate. And let's assume that about half of the clients have one child on average. So again, $3,600 times 15 years is about $54,000. The discounted present value is about $17,600. But only about half of the rehabilitated people, at least in this calculation, receive that benefit. So now we're at about $5 million, $5.7 million in total benefit, and we divide that figure by the 2,614 authorized clients, and we get about a benefit of $2,100, $2,200 per authorized client. So now we've done the private benefits to the person being rehabbed. We've done the benefits to, let's say, one component of the related people. And we're only focusing on income here. We're not focusing on quality of life. Now, let's think about the public benefits. Recall the Aetna study. For every $1 substance abuse programming spent, we have about $4 in healthcare cost savings and about $7 in penal cost savings. Wow, so that's about $11 for every dollar spent. The budget, wow, well, I see here that I've miscalculated. I have a $4,000 budget here. Was really about $9 million. So the benefits are going to be 11 times 9 million. So we have a large benefit of roughly about $100 million of public savings as a result of the substance abuse program. So that's about 40,000, not 19,000. I really apologize for this error here. It's about $40,000. Excuse me, about 40,000 per authorized client. So now we have a huge public benefit, right? We save tax dollars way into the future by avoiding these kinds of costs down the road. So we sum up the private benefits to the person directly receiving the service, the indirect benefits of the person who might be related, who's also benefiting, and then we also add the public benefits as well. And so now, and then we subtract the costs, and you can see here, even with my underestimation of the public benefits here, with my miscalculation, we have a huge benefit, really substantial. And if we can also do net benefit per authorized client, and again, it's substantial. It's actually substantially larger than this, with a very large cost-benefit ratio. If you take the benefits in relation to the costs, it's quite substantial. So this is maybe larger than some of the other studies, but in general, the benefit cost ratio is relatively high for these kinds of programs because of the cost savings down the road. It helps you think about how to value the benefits of the program, of this kind of program. All right, so that's the basic framework. Let's talk about some things we want to be careful with. With any evaluation, we have to think about our assumptions. One question that we might want to ask are the research findings applicable to the program of interest? So I've referred to several studies here, but I might want to take a closer look and say, well, what kind of program do they have? And is that program similar at all to Oakland County's program? Maybe there are some differences. Maybe they're not directly comparable. Maybe we want to look at results from several studies. It's probably not going to be the case that you can do a full evaluation like the one you would find in a peer-reviewed journal article, like the ones that I refer to, but you can rely on that research, and you can do some sensitivity, and you can find the kinds of programs that are most similar to the one that you're interested in. I've made some assumptions about the benefits to those who are connected with the clients. I don't have direct information on income earning potential of, let's say, a child who has to live under circumstances of substance abuse in relation to a parent versus not. But we do have indirect evidence, so I've drawn on that to take a look at that question. We have the success rates of clients. Maybe Oakland County's success rate is a little bit different than the average, and so you can actually, again, test the sensitivity with different success rates. And maybe the most difficult challenge is trying to get a handle on whether the person would have been rehabilitated without this particular program. Maybe they would have been able to rehabilitate for some other reason or some other resource or through family or something else. And so we have to make some assumption about if it hadn't been for this program, what would the outcome be like for the people who wouldn't have otherwise had this. So we can test the sensitivity of our findings to a range of values and assumptions, and then if under those different scenarios you still get benefits that outweigh the costs, you can be pretty sure that the benefit, the program is leading to an overall societal benefit. But we want to be careful, and we want to be honest about, as honest as we can about the assumptions that we're making and the limitations that we have with the study, and then testing the sensitivity of evaluation to the assumptions and the range of values. So that's kind of the overall, I guess, overview of how we do a cost-benefit analysis in a way that doesn't require a lot of additional resources. If you can rely on some of the existing studies, that's very helpful. And I would say that, even if you have, some issues like the assumptions and limitations, a thoughtful evaluation is far better than no evaluation. It gives you a sense of where you are with the program, and it gives policymakers information about, well, should we expand the program? Should we cut back? Is there some other higher use for those funds? And then you can be more accountable to the taxpayer as well. So here are some references in case you want to go and pull those studies to kind of take a closer look. But again, you might want to do a literature review that's more specific to the particular program that you're focusing on. So we've been going now for about 35 minutes, and I've kind of gone through the core piece of what I wanted to talk about in terms of, getting a handle on the benefits to society, the private benefits, but also the public value, and then weighing that against the cost of the program. Maybe I'll open it up now to questions.
Well, thanks very much, Dr. Skidmore. This is a great overview of how to do some of the basics of a cost-benefit analysis with this type of topic of intervention at the community level. One question I had was, are you able to correct the slides so that we can get a corrected version posted to the website?
Yes, absolutely. I apologize to the whole group for the miscalculation there. We'll get those straightened out. As soon as we get off here, I'll fix that and get it out to you.
Okay, so we'll for Karen question, we'll post those on the website as soon as we get the corrected copy. The recording is also going to be available off of the healthbench.info website, Deb Fried, so that's available. One of the things we're doing with the SAMHSA supported project is collecting some more resources in this general area of different types of effectiveness studies that have been done. So that database will be going up within a couple of weeks, so everyone can check back for that in the near future. A more technical question for you, Dr. Skidmore, is thinking about those public officials, I think you mentioned something about election cycles. Um, and what do you think the is the discount rate of a public official going to be the same as the discount rate as of the general population?
That's a good question, Scott. For those of you who aren't familiar with present value calculations, the discount rate um, is a measure of how much you value for example, a dollar today versus a dollar way into the future, and so for most of us, we prefer a dollar today than a dollar in 5 years or 10 years, because we can do something with that now, and if only if only to take that dollar and put it into some sort of interest-bearing account, you get a return on it, so that in 5 or 10 years, a dollar might be worth $1.20 or $1.40, or whatever the return is. And so, everybody has a slightly different discount rate. If you are, in a difficult, dangerous situation, you might not care about the future so much. But if you think the future is bright and you expect to live a long time, then you might value the future more than you do now. If you're a politician and you are facing a 2 or 4 year election cycle, then maybe you really care about the benefits right now, right? Because in order to get reelected, you might want to focus on spending priorities that give you a bang for your buck today rather than in the future, and that's a real challenge. And it's an open question, but my sense is that for elected officials, they may have a discount rate such that they value getting the benefit today rather than into the future, and so they discount the future more so than the average person. I know, Scott, you have your view on this, and you're sure welcome to interject if you'd like.
Well, just in your experience in working with government officials in the public finance area, this has to have come up in a number of contexts, and so what are some ways that you might have tried and might have been successful with in terms of trying to get those public officials to think a little bit further in the future, kind of beyond that next election cycle?
Well, the challenge comes up in lots of different ways. For example, one example might be Social Security. We've not funded that fully, but that requires a long-run investment, and we're just not facing that reality right now. It occurs also in the funding of public pensions. That requires a long-run investment. We got the benefits now, but do we really want to pay, all of the promises that we've made? So we've underfunded that. We tend to focus on the immediate thing for expenditures on different programs at the expense perhaps of not thinking more long term, like investment in capital that lasts a long time, or investment in these kinds of programs that yield benefits, public benefits well into the future in terms of cost savings. But it's hard for politicians to make that kind of investment. So we do some trainings with newly elected officials, and we do the best we can to say, there is this challenge as an elected official to get reelected, and that may lead you to spend less on programs that yield benefits way out in the future, beyond when you'll be in office or when you'll be reelected. But we've got to think about that, and that there are real implications of not doing so. And that is the underfunding of programs that yield these kinds of long-run benefits into the future. So it's a challenge, and we talk about it, but I don't know that we've really fully resolved it at all. It's an ongoing challenge. I see Brian has asked a question here. Are there studies relating to the percent of participation that would have sought help elsewhere? Um, Brian, I wasn't able to identify, you know, research specifically with substance abuse on where people would go to help if they hadn't gone to help in a public program. Some people might receive help through family or other resources that they have available to them, but I wasn't able to find something specifically on that.
That might be a future research topic to look at those kinds of questions.
Yes, that's true. Thank you, Brian.
So I think one of the takeaway there is, in doing this kind of work, you're not going to always find every little bit of data that you might want in doing this kind of analysis. And at some points, you are going to have to make reasonable assumptions to get to your estimate.
Yeah, and that's right. And as I said, when I do these kinds of cost-benefit study or benefit cost studies for some sort of public expenditure, I usually do a kind of like a couple of, say, 3 scenarios, sort of the mid-range scenario, a scenario where, that's sort of an upper bound and a lower bound. And that gives me a sense of how confident I can be in the overall conclusion. Did the benefits outweigh the costs? And under what circumstances did the benefits outweigh the costs? Are there any thoughts or questions you'd like to share?
And how do people respond to those different scenarios then when you present it in that way?
Well, I think they appreciate it because I think if you can show that you're being transparent, that not there may not necessarily be a definitive study. Most studies are not definitive, but if you can kind of say, we're trying to get a handle on this. We're not trying to justify a program per se. We're trying to get a handle on, is this a good use of funds or not? Maybe we need more funds. Maybe we need less funds. How does it compare to the tax dollars have to go to fund lots of different things. My sense is that for these kinds of programs, we may be underfunding because of the long-run benefits, both to the public as well as to the private individuals and people who are related. I see Holly says, I agree with Brian. Is there backing based on geography or particular intervention? It's a good question. I agree. How do I think the value may differ in rural versus urban spaces? I think we have substance abuse issues in both. Off the top of my head, I can't think of any specific reasons why there would be systematic differences in rural versus urban spaces. There may be, I just don't know why there might be, if there's a particular reason. Are there any comments?
Seems like the density of programs might be smaller in a rural area. So if you're, the entity offering the program might be in some ways kind of a spatial monopoly, and so they might not seek help elsewhere. They might, it's either that place or nowhere, because it's 75 miles to the next closest provider of that service. So,
yeah. Well, and along those lines as well, in a rural place where there's less dense population, you might have higher per client costs. So the cost portion of the equation might be a little higher.
mm-hmm. Yep. So it is important to take into consideration the context of the program offering and try to get as close as possible to the situation at hand.
Yes.
Well, I'm not seeing other questions, so I want to thank you for spending a few minutes with us this afternoon, and we will get these things posted um, forthwith.
All right. Thanks everyone for taking some time out. Appreciate it.